Hi, everyone.
Hi.
Hey, thanks for being here. We're really excited to have you join us today. We were just going to get started. I'm sure that there are a lot more people RSVP, so people may be coming in. Feel free to turn your camera on if you like, but also feel free to turn it off. And we're asking everybody to mute. But if later on, we're going to have a sort of the Q&A session. So during that time, feel free to come off, unmute, but if everybody's good, we can just get started. And we'll be also recording as we speak. We'll be recording this session for those who told us specifically they cannot join, but we'll be sharing this. And more people are coming in, which is great. So, all right, welcome everyone. My name is EJ, and I am a chief member. This is my third year, and yeah, we're really excited to kind of, have you join us to talk about perimenopause. I am a, co-founder and CEO of NNABI, which is soon to be launched wellness startup. And that's really laser focusing on supporting women in perimenopause. It was co-founded by two women in Peri, myself and my co-founder, who will show up in a bit to introduce herself. Perimenopause is something that we actually didn't realize it was until we did a lot of research and we kind of found ourselves in perimenopause. If it wasn't for each other, we probably still asking ourselves, like, what is happening? Why do we feel off? And then probably going to doctor after doctor trying to get the answers. We've done, between Marina and myself, and we have some photos to show you that we've kind of been together, being friends, past 10 plus years. We met at work, and we both in advertising and media business. And, over the 10 plus years, we've been just sharing a lot of just like, what girlfriends do, talking about our sort of hormonal issues and pains and, experiences and, do you feel this way? And, what about, so that conversation really just kind of sharing a lot of the issues that we have dealt with as young women and now getting into midlife. And, we sort of stumble upon perimenopause. And as we learn more about perimenopause and do a lot of more research around it, it was really kind of shocking that, doctors weren't really able to help us because, they were not really trained during their med school, but we were still feeling off. And then, when we reached out to our circle of friends, a lot of women like us are just kind of dealing with it invisibly. And that was sort of like, okay, we are very all strong, intelligent women, but we just know very little about perimenopause and, people and don't really think about that there's something fundamentally hormonal is just kind of impacting kind of how we feel. And in fact, we actually did research and among 400 peri women, and they were saying, hey, I'm some of the symptoms are impacting my day-to-day. 9 out of 10, they're saying that it is impacting me in a negative way. But when they're talking about like what's actually contributing to feeling that way, 30 out of 10 say perimenopause. So congrats to those 3 out of 10 women who actually know what's going on. But then 2 out of 10, they say menopause. And today we're going to actually have experts talk to us about the difference between perimenopause and menopause. So 2 people were actually very much perimenopause based on the criteria, but then they're saying, oh, it's menopause. Then there's 5 out of 10 people. They're saying, oh, it's my life choices and lifestyle. Like I'm drinking, I'm not sleeping. And all of these things actually matter and it does impact how we feel. But I think the point is that is actually there's something fundamentally that we're going through as we are getting wiser. And there are a lot of just things that we just don't know much about. So perimenopause starts as early as in mid-30s. Wow, like people, whenever we say stuff like this, people are like, really? And yes, it's true. And it could last 10 to 15 years of our life, which is a very long time if you don't do nothing and we're just kind of taking it in and how it's impacting us. So, for one good example is like, for example, my symptoms for perimenopause, which is going to be very different than, Marina's and some of you here. Apparently there are about 48 symptoms out there. They're identified as symptoms that we can experience. So for me, I'm experiencing migraines, feeling that more anxious and, have like sort of low mood, and I am feeling more irritable, and I'm having a bit hard time concentrating, but like I didn't feel that way before. And then there's sort of like the vaginal dryness, which is actually one of the, kind of popular symptoms as well. And sort of the forgetfulness. The sort of another thing to just add into the laundry list, the dry eyes. Dry eyes is actually one of the symptoms that you can experience during this time. For me, that's been quite painful. So the more we learned about perimenopause and talking about it and talking to our girlfriends about it, we just kind of start getting a bit angry. We're feeling this way. There's not much we can do, at least, go to doctors, but then like we have to go to multiple doctors, and sort of like we're just talking to a lot of people and wanting to put this anger and insight into something productive. And that's sort of the birth of NNABI. And that it's all about being a sort of peri-only company, because perimenopause starts early, can't last very long time while we're still menstruating, while still we're trying to think about, getting pregnant. So, until we reach that point of menopause, which is but defined by you have not had your menstrual cycle for 12 consecutive months, there's a very long time, and we felt that there is a dedicated care and attention is needed. So I'm gonna now bring on Marina, the co-founder, and she's gonna kind of walk us through like what's in the program. And we have two wonderful experts, both women, and are gonna talk to us about what, everything you may want to know about sort of Peri 101. So I hope you guys enjoy, take some notes, and also feel free to ask some questions. This is meant to be like a presentation, but please let us have a dialogue with you guys. So we're looking forward to spending some time together. Marina?
Hi, everyone. I'm Marina Penn. I'm co-founder of NNABI, and as EJ mentioned, we started this journey 2.5 years ago, and we have never looked back. We are very invested in this. We truly believe that women in perimenopause are the driving force of society, at work, at home, taking care of our family, our kids, our parents, and we deserve this dedicated care and dedicated solutions that are made exclusively for us and for this phase of our lives. And in the time that we've been working with on NNABI, we have heard so many stories of women going through Peri without knowing that they are in Peri. And we feel that for too long we've been in the dark. We haven't been sure of what to expect of this journey, what it is about. And that's the reason that we're here today. We want really to start to change that understanding and help more women ask themselves if what they're experiencing is perimenopause. Like, we really want to help women ask, like, am I peri? Is this peri? Are these peri symptoms? Knowledge is power, and action leads to change and leads to things, changing and hopefully getting better. And today we're very happy to bring together two brilliant physicians, Dr. Junella Chin and Dr. Karolynn Echols, to shed some light on perimenopause, what it is, what it's perimenopause, how it's different from menopause, why it's crucial to make some lifestyle changes and adjustments during this phase to feel better. And if anything, our goal for this session is very simple. We want you to walk away with a very clear understanding of what your body goes through during perimenopause, and that you can do something about it and that you can feel better. So before diving in and before properly introducing our doctors, just a brief reminder that this is for education purposes. This only should, you should not take this as individual medical advice. This is a webinar, it's educational. So please, take that into consideration. And of course, if you have any specific questions, feel free to drop them in the chat. So let me introduce you first to Dr. Junella Chin. Dr. Chin has specialized in holistic medicine for over 2 decades. She has founded and operated 7 bi-coastal integrative cannabis medicine clinics in California, New York, and Connecticut. Her training includes nutritional biochemistry at Cornell, Touro University College of Osteopathic Medicine in California, medical acupuncture at Harvard University, and research at Columbia University. Dr. Chin is currently professor at NYU and Syracuse University. She teaches cannabis health and science. She's also vice chair for Cannabis Advisory Board of the New York State Office of Cannabis Management, and also chair of Health, Safety, and Research Committee for OCM. She's also the author of Cannabis and CBD for Health and Wellness, and through her work as a clinician, as a professor, and also author, she has created medical protocols for the industry and internationally accepted methods for cannabinoid formulations, research, education, and training programs. Hi, Dr. Chin, welcome.
Thank you so much. Thank you so much for having me today. Thank you everyone for joining us this evening.
And then very quickly, let me please introduce Dr. Karolynn Echols. Dr. Karolynn Echols is integrative urogynecologist. She's also bringing more than 20 years in medicine and women's health. She's Bachelor's of Science in Electrical Engineering from Cornell University. She also is OB-GYN, and she did her residency in the University of Miami, and also a fellowship in urogynecology and reconstructive pelvic surgery from Louisiana State University. She also does a lot of philanthropic work in obstetrical fistula urogynecology surgery and gynecology in Cameroon, Nigeria, Kenya, Rwanda, and Jamaica. She also is associate professor, section chief of female pelvic medicine and reconstructive surgery at Thomas Jefferson University and Hospital. She's president and co-founder of Medicine in Action, honorary consultant of the University of West Indies in Kingston, Jamaica. And then she's the first urogynecologist appointed to the American Board of Integrative Medicine Written Board Committee. Hi, Dr. Echols, welcome.
Hi, thank you so much for having me. Welcome, everyone.
Okay, so let's do this. Let's jump into the questions. So our first question for today is, starting from the basics, perimenopause 101. What exactly is perimenopause?
I'm dialed in right now.
So what, Dr. Echols, let's start and let's start talking about what exactly is perimenopause. It would be great to understand how it's different from menopause, what makes it specifically perimenopause, and just like really how to understand this concept overall.
So, when you think about perimenopause, you have to think about the words premenopause and menopause. So I'm going to define them all. So perimenopause is kind of the time before menopause, when your ovaries, gradually stop working. And it's basically the transition phase from premenopause. It lasts, according to the National Institute of Aging, 6 years, but I got to tell you, it's probably a lot longer, probably about 10 years or so. And it's a natural process that causes like physical and emotional symptoms. It typically occurs in women in the mid-30s to their 40s and early 50s. And it depends on when they stop having their periods for 12 months. And that's officially known as menopause. When you look at premenopause, that's defined as the time between when someone gets their menses for the first time to the onset of perimenopause. There are 4 stages of perimenopause. You've got the very early perimenopause, the early menopause transition, the late menopause transition, and then late perimenopause. And basically, these symptoms can change depending on what state you're in. When you have early menopause, you can have that and your periods are still regular. Something's going on. You're not sure what. And then it can turn into irregular periods and become late, menopause transition. And then your cycle is more than 60 days. And then you go to the late perimenopause, which then you go to menopause, which your periods stop for 12 months.
And can I ask a question, Dr. Echols, in terms of hormones? We know that perimenopause is known by crazy hormonal shifts. Would you be able to talk a little bit about what happens to your hormones during perimenopause?
Absolutely. It's so you think about estrogen, and progesterone and LH and FSH. And so you're getting your period, and it depends on what stage of perimenopause you're in. But your levels can fluctuate. And when they fluctuate, that's when your symptoms can get worse and then get better. And sometimes you don't know exactly what's going on. You can get high estrogen levels, which can cause a lot of symptoms, even headaches. Low estrogen levels, which can make you irritable. And so these are kind of things that, unfortunately, the hormone levels vary in this time period. But there are kind of things that you can do to measure to see what's going on. And don't forget, there are other things that can happen at this time period, like thyroid disease, even vitamin deficiencies, that could cause some of your symptoms as well.
That's great. I think that it's a great lead for our next question, which is, am I peri? How do I know that I'm peri? What are the symptoms? EJ was talking about there's like 48 plus symptoms that we could experience. Are there tests? Like, we do see a lot of different companies offering tests. Like, how do I really know I'm peri? And how, just like how I establish it from a medical perspective.
So we'll start with like the most common symptoms, and I'll go into kind of the tests. And so something's off. Like, you can get night sweats. There's up to 50% of women that'll get like hot flashes. Night sweats is sudden waves of body heat, sweating and flushing that lasts for 5 to 10 minutes. And it can last at night and during the day. You get your changes in the menstrual cycle. They can either be lighter or heavier or even irregular. Changes in sexual desire. No more libido. I don't want it. Tired. Mood changes. Just irritability. Trouble concentrating. And, you've heard the term brain fog. I forgot where I put this, or somebody introduces you to someone right there and you forget their name right away. Headaches, as I said earlier. EJ was saying vaginal dryness, that can occur. Don't forget sleep disturbances. I mean, you can get early morning wakening at 3 a.m. Why am I awake? Trouble falling to sleep and even falling back to sleep. Urinating issues, leaking, constipation, trouble losing weight, fatigue. All of these things can happen in perimenopause. Now, there's blood tests that can offer more information about, hormonal changes, but it's important to note, that's still only a part of the diagnosis, and there's no single blood test that's reliable and that predicts when a woman is going through menopause or the menopausal transition or perimenopause. So the blood test looks at key hormonal levels, and bone health and cardiovascular risk. It'll also look at thyroid hormone levels, thyroid dysfunction. So you want to get, LH, FSH, estradiol, TSH, and then, the T4 and T3, which is the thyroid hormones as well. Those are kind of the basic things that may be covered by insurance. And then there's also what's called a Dutch test, which is an acronym for dried urine test for comprehensive hormones. And basically, it can be used by anyone. But for our purposes, I'll basically refer to women, experiencing with the test. And so the test basically changes based on whether you're cycling or you're still having your menstrual cycle. It's really not useful for postmenopausal. So it's useful in perimenopause. It costs about $200. And you use dried urine. And so, but you need to collect it at different times. And that's how you get the specifics of what's going on. And that's really important to follow explicit directions, and then explicit directions in collection and explicit directions in sending it out to the lab. Don't forget about, your other, vitamins and say B12 deficiency. Everybody's D deficient, especially in the Northeast. Thyroid hormone as well. And so these things can actually cause some of your symptoms that you may be having. And there's a lot of symptoms. As EJ said, there's probably over 50 symptoms. And I can't really, I mean, just to be, for time's sake, I'm not going to go over all of them here, but it needs to be worked up. And if you think something is wrong, you need to actually make sure that your provider knows.
Thank you. Yes, I do know I suffer anxiety, insomnia, just brain fog. So there's a whole suite of different symptoms. And just thinking about, and Dr. Chin, this is a question for you, thinking about what we can do about it. So we've established that we might be in perimenopause and we really want to do something about it. So it's important just to try to understand what are the different things that we can do to alleviate symptoms. There are natural solutions. Of course, we know about hormonal HRT solutions. There's lifestyle adjustments. Also CBD, we do know that a lot of women in perimenopause and menopause are using CBD to alleviate some of these symptoms. So it would be great if you could talk a little bit about what are the different resources and tools that women have to start alleviating symptoms and start feeling better.
Sure, sure. So I think, the first and foremost, when patients come to me and ask me, do you have any natural remedies or natural ways that you can suggest that I treat my perimenopause with, I always preface that with, make sure you've seen your women's health specialist, your gynecologist, and you have confirmation and assessment that you are in the perimenopause phase, right? You want to make sure that you rule out any other conditions, like Dr. Echols mentioned, thyroid, make sure you have, health monitoring, there's, contraception and family planning. So you've gone through all of those types of issues and points with your health provider. And then once you have established that, there are a few things that you can do that are in, I would say, the realm of integrative or natural care. If you don't want to take prescription medications, you can look at your basic lifestyle changes. So the first thing that I always talk about with my patients is diet. So I'll go through it, have them take down their typical diet for 3 days, no judgment, but, let's just take a look at what you're eating, the times that you're eating, perhaps when your symptoms are, when are you getting the hot flashes? When are you getting the brain fog? So I really take a very holistic look at how diet is playing a role with the symptoms that you're complaining about. And then I look at, especially caffeine, alcohol, and sugar consumption. How often are you using caffeine? Is it close to bedtime, for example? The past 2 p.m., perhaps that's getting in the way of your sleep cycle. Are you having alcohol with dinner, right? How much sugar intake are you having? So I look at that. Then I look at movement. Are you moving? How much are you moving? And this doesn't have to be a Peloton. This doesn't have to be SoulCycle. You don't have to engage in intense physical activity, but are you walking during your commute to work? Are you walking the dog? Are you, playing with your children? What are you doing for regular movement to help improve your mood and maintain a healthy weight? Are you doing moderate, intense exercises? How many times per week are you doing that? Another thing we talk about is stress management. We always just so easily say that, oh, we're just so stressed. We're so stressed. It's become a norm, right? If we don't say that we're stressed, it's almost like we're not productive enough. But, stress can really exacerbate perimenopausal symptoms. So I talk about how patients practice stress reduction. Are they meditating? Are they doing deep breathing, yoga, or any mindfulness techniques? Are they using apps, calm apps, for example? And then we go through their sleep. What time are you going to bed? What time are you waking up? Do you need an alarm? Are you having restorative sleep? Do you have sleep apnea? Are you waking up throughout the night? What's going on during sleep? So we make sure that there's no physiological reasons why you are having disrupted sleep. And then we'll go through some natural remedies that you can use, but I always look at the prescription medications first and making sure that herbal remedies, although they're natural, can affect your prescriptions.
Thank you. And would you be able to talk a little bit about, when it comes to CBD and any recommendation that you might have to alleviate symptoms? Are there specific things that you look at before suggesting this kind of treatment or solution? It would be great to get your expert, point of view on how you manage that for perimenopause.
Sure, sure. So CBD comes from the hemp plant or the cannabis plant. CBD is part of the plant that does not make you feel high or euphoric. CBD is sold over the counter, so you can get it at a dispensary. I know Wegmans by me has a whole aisle of CBD products. So you do have to be careful because CBD is not federally regulated. So you want to make sure that you pick a company that has transparency, that tests their products, and you have a certificate of authenticity. So there was a recent article actually about melatonin and how they found that the melatonin dosages, were not what was labeled on the bottle. And even though melatonin is over the counter, you find it at CVS, at Walgreens, any health food store, you still have to be careful about which companies you purchase these natural products by. And CBD is just as important. So when you do find a CBD company that is reputable and you trust, you can use it for temporary relief of hot flashes, mood swings, anxiety, and insomnia. Cannabinoids and CBD can help basically turn the volume down, I would say, on your nervous system. A lot of patients will tell me when they use CBD, it feels like they did a yoga session or feels like they went for a big long run. So they're able to focus, they're able to work, they don't feel high, they don't feel altered, they're clear-minded, but they just feel a little more comfortable in their skin. So you do have to be mindful that CBD can affect prescription medications. So you want to make sure that you talk to your health provider and let them know that you're going to be starting CBD.
Thank you. That's all very helpful. And I'm a big advocate of CBD for alleviating some of these symptoms. I love how you were talking about, it feels like you took a yoga class. It's yes, 100%. I can, I feel that way. So last question, Dr. Chin, and this is something that we hear a lot from women that we speak with. And also, there's several articles about having conversations with your doctors about perimenopause. We hear women being dismissed or being told just to, you're too young to be in perimenopause or just suck it up. So what is, from your perspective, the best way to approach your physician to talk about perimenopause, how you should prepare for that conversation, any red flags, that you should be aware of, but overall, just how we can help guide women to advocate for themselves, for what they need, for the symptoms that they are experiencing, being validated, and just feel comfortable having these conversations with their doctors.
Well, that's a really great question. I would say the number one thing is to educate yourself. So attending webinars such as this one is really helpful. Talking to your peers, your girlfriends, your colleagues, and chatting it out before the appointment. So that way you're gathering your information, and there could be misinformation, but at least you're trying to educate yourself and sort of get the lay of the land, right? So you want to take your time, educate yourself, listen to podcasts, going to webinars, reading up, being well informed, so that when you do approach your health provider, you can ask relevant questions. And then I would say keep a symptom journal. Start keeping a diary of all your symptoms, their frequency, their severity. Note any patterns or triggers that you observe. Is it when you're more stressed? Do the triggers worsen when you are sleep deprived, for example, or again, if it's diet related? And then you want to make sure you choose the right healthcare provider. There are so many health providers out there, and you can always switch. And if you look under your insurance, there's always a list of health providers by specialty, by location, how long they've been in practice. Also, things that they might be interested. If you find a health provider that's integrative, for example, or that takes care of communities of color, for example. So you want to make sure that the healthcare provider is medically and culturally competent and speaks your language, right? So you want to see someone that has an expertise in this as well. And then I would say be open and honest. I can't tell you how many times a patient will come to me about their perimenopausal symptoms, and it's not until their like 5th or 6th visit they're like, oh yeah, and I want to talk about libido, and they say it in such a whisper, and you know, there's nothing to be shameful about it. You be open and honest, you know, say, I just don't want to have sex anymore. Like that could be, if that's the number one thing that bothers you, that is okay. And you should bring that up to your health provider. If you say, you know, my vagina is just so dry and so itchy, and it's affecting my partner. I mean, that is a very, very valid thing. And that could be the top of your list. So you should be open and honest and be comfortable when you talk about that with your health provider. Don't be intimidated. And if your health provider doesn't make you feel comfortable, then you'll find another one.
I love that. I love that because many times we do feel obliged to, you know, just stay with our doctor. But to your point, if we're not feeling that they are giving us the solutions that we're looking for, or the answers, or even like the comfort of having those conversations, just, you know, looking for someone that will do that for us. So that's incredibly important. I don't know.
I want to add to that.
Yes.
I love that. Don't take no for an answer, basically. You know, don't let anyone brush you off, because it's valid. And so you bring it up, and if it's something that, say, you don't understand, ask the question. And if the question isn't answered, it is okay to find somebody else. It is okay to have two providers helping. It is okay, but talk about it, because it is an issue. It does cause a quality of life problem. And we live till 80s, 90s, and you know, this is something that affects your health moving forward. And so ask the question, get the help that you need.
Thank you. Well said.
There's a good segue.
Yes.
So there's a good segue to anyone who, I mean, we kind of, you know, kept it kind of one-on-one, didn't want to overwhelm us so much, but still good enough to kind of get the sort of picture of what Peri is. And not seeing any questions in the chat, but I would love to open up to see if there's anybody, you know, has any questions. We do have 2 experts online, so please take advantage of this time. Anyone? Oh, we do have one. There is a lot of hype around hormone balancing diets, treatments, etc. Is there actually any evidence around this helping to maintain health, feeling good, reducing symptoms? How to spot a good provider versus a hype provider? That's a good one.
So diet-wise, I think the 2 diets that are out there that do help symptoms are low simple carbohydrates, low sugar, and also the anti-inflammatory / Mediterranean. There's also plant-based, but you have to be plant-based. Not plant-based can include potato chips, but that's not plant-based. Healthy plant-based. And there's some evidence surrounding that, as far as helping some of those symptoms. And I didn't see the second question, unless you have something to add, Dr. Chin.
No, I would agree. I've heard some really crazy diets out there, but the 2, I would say the 2 that sticks, that has the most clinical evidence, and even my patients can follow and manage, like actually practical, are the Mediterranean diet and low sugar diet. I agreed.
Hope that was helpful. There's another, next question is about HRT. Can you talk about HRT, like what it is, if it's used in Peri? What are your feelings about HRT?
You want me to start, or you want to start?
Whoever wants to jump first. It's probably we need to do like a separate webinar about HRT because there's a lot to unpack.
Go ahead, Dr. Echols.
Yeah.
That's a can of worms. Okay.
Yeah.
So listen, all right. So basically, HRT is not a bad thing. There may be some contraindications, and so you definitely need to talk to your healthcare provider, but there is a role. And you know, you look at the study that, looked at HRT, and then as women get older, increased risk of heart disease, which as women get older, there is an increased risk of heart disease. So that's why they actually look at 5 to 10 years of HRT, helping with, the vasomotor symptoms, the symptoms of peri, also symptoms of menopause within 5 years to 10 years of menopause. And then after, that's when it's most useful. And then the studies show that as that goes on, it's not as useful, but some patients swear by it. And so as long as there's no risks, HRT is fine. I mean, there's a new article that just came out. I think it's the Green Journal, which is basically one of our OBGYN journals, regarding breast cancer and using topical estrogen, and it is okay. Vaginal dryness is a quality of life issue that is horrible. Itching, burning. I can't tell you how many patients come in and it's like recurrent urinary tract infections. I mean, and then they wind up getting septic and getting pyelonephritis, and because and the breast cancer survivors so afraid to use hormones. And so topical hormones are okay. It's just you have to make sure that you're being watched by your healthcare provider, that the evidence out there, maybe a little bit of the risks. Oral estrogen is not for vaginal dryness. It has not been shown to help, but topical has. And then some of the vasomotor symptoms, sometimes topical can help. I'm not even going to get into the bioidentical hormones because that's another can of worms. But you also have to watch that as well, because you need to get your labs drawn. Very important. I mean, there are some companies out there that say, oh, you don't need your labs drawn. We can just give you the pellets and that's it. No, make sure, because I've had patients come in, cholesterol out the wazoo, testosterone levels over 1,000, sick. And so you just want to make sure that you're getting the right treatment for you. And people start hormone replacement even before they're in full-blown menopause, in peri.
Okay, that's helpful. Okay, moving on to the next question is, can you still have peri symptoms if you're on birth control pills? Great question. Because I think there's a lot of talk about people questioning being on the birth control, and through this NNABI journey, we spoke to a lot of women that have been on birth control for like 2-3 decades, and now they're finally in their mid-30s kind of questioning. So I think this is actually a really interesting and an important question. I don't know if Dr. Echols and Dr. Chin want to chime in here.
Okay. It's OBGYN, right? So birth control pills can cause vaginal dryness. They're for contraception. They can cause vaginal dryness though. And actually some people with long-term birth control pills, it can cause issues with the vulva. So it's kind of like a lichen sclerosis type vulvar dystrophy symptom thing on oral contraception, but it's also protective against ovarian cancer. So, they also give oral contraceptive pills sometimes surrounding, and I don't do this, but some providers do, surrounding perimenopause to help with the symptoms, because it helps keep your hormones level. So it just depends on each patient. Each person is unique and individual, and what works for them.
Thank you. We're going to do one last question. Is, are heavy periods also related to peri? Dr. Echols, you did mention, periods change, right? Like you kind of had to understand, like it could be shorter, longer, heavier, lighter. I mean, that's the change that you kind of know, right? Like as you're menstruating, you can also do like a journaling of your menstrual cycle. But just a kind of quick comments on heavy periods and peri.
So with heavy periods, you just have to make sure there's no underlying pathology. Don't forget, as we, perimenopause into menopause, fibroids, polyps, especially with, estrogen. If you have a lot of adipose tissue or fat tissue, then you're secreting estrone, which is a type of estrogen, which can then feed the uterus. And then, you know, don't forget some of the bad things like cancer. So you want to make sure that you get the workup. Heavy regular periods can be peri, but they can also be fibroids. And so you want to get the workup. You want to make sure that you let, you know, their provider know and get the workup. Sure that it is or is not. You have what's called adenomyosis, which essentially is the glands of the inside of the uterus, the endometrium, it's called. Of the uterus. And that
Yeah, Dr. Echols.
probably peri.
Yeah, I'm not sure. Sorry about the sound quality. So what we would do is there's some good stuff coming through, and then Christine, totally hear you. I mean, that's like one of the sort of frustrations that we hear when we speak to a lot of women in Peri. There's just like almost like there's a group of people, like there's so much information, kind of not sure how to like navigate through. There's like a group of people who are like, I don't even know where to look. There's a group of people I'm like, there's like not enough. So I think these are the things I think it's kind of why we studied NNABI, and wanted to kind of create a place where very Peri specific information, and having doctors like Dr. Echols, Dr. Chin, to really, you know, talk medical, right? So this is not like an illness, right? Like perimenopause, menopause is not an illness. However, this is a health condition. So I think, and this is really important. So we want to make sure that you guys are getting the right kind of information, like we would, right? Like we in order for us to navigate our sort of day to day. What we can do is, since we kind of tap our time for 45 minutes, we're going to take some of these questions to make sure that can be our follow-up through our social, and also to some other events like this, that we can do another sort of like Peri 102 type of, to kind of gradually build, so that we have opportunity with this community, that we can, you know, have you know, ask questions and share some knowledge and kind of teach each other. I think that would be great, because I think when you start talking about Peri, and I think you'll be surprised that it sounds like no one's really talking about it, but then when you start talking about it with your girlfriends, like it all come out, like everybody's dealing with something. So I think it's a matter of like starting the conversation. So Christine, yes, actually that could be the next, you know, we can go to the next one. So we do have a social handle. Sorry, I'm like, we do have a social handle, but let me just do a quick takeaway recap. Sorry, I'm like rushing time. So I'm like, so Peri, it's a distinct phase, right? So sometimes we get really overshadowed by the big sister menopause, but we have a bit of a time to get there. So the point is, let's focusing on what we're in it. So really think of this as a distinct phase and deserves dedicated care. So let's really dive in and help all of us, each other, just to build that community. Symptom identification. You all know your body the best, right? So, you know, trying to, you know, as Dr. Chin, like, you know, take some journaling and your behavior, all of these things. Peri, it's not like a headache. You're going to take Advil and hopefully you'll feel better tomorrow. It's actually kind of like a phase that we'll just have to go through. And I think this is a great time, I think, for us to really learn about our body, how we are changing, because whether we like it or not, it's our biology. We're not going to change the biology, but we can work around it, right? So understanding the symptoms, what is your Peri experience? Because that's very different than, like, for example, Marina, by the way, who had 2 kids during perimenopause, and, you know, talk to your doctor. And then also ask for, you know, knowing that there's no one test, as Dr. Echo said. It's not like it's not like a pregnancy test. It's not like there's only one test to tell you that yes, you're in or not. So there's a bunch of different sort of lab work that needs to go. So you really do need to build that kind of relationship with your doctor, so you can really go through the, you know, discovery phase together. There are many tools, as Dr. Chin said. I mean, really, again, this is like lifestyle, sure. There could be some natural stuff you can do, sure. There might be some medical, you know, the hormonal, like, you know, the medical, like, prescription, sure. That all these different sort of options, it really comes down to your body, your preference, what works for you. So I think that's the kind of, like, you know, it's a little bit hard to pin down, like, you know, for Peri, this is the solution. But this is where we want to equip you with all the knowledge and information as much as we can, so that you can start asking this question and really number 4 is all kind of coming together. We really want all of us to advocate for our health. If you're not asked, maybe you're not asking, your doctor may not do any of this, lab work for you, for example. So like ask these questions, be prepared, so that when you do show up for the, doctor visit, you are a little bit more prepared and ask some more very specific question. So moving on to the next slide. So we kind of, jot down, like, obviously, we do have a social handle. Thank God. It took a while for us to get up there. It's still coming soon, guys, but NNABI.life on Instagram, please follow us. We do have some initial sort of, posts up, but then more to come. And also we do have a sort of coming soon page with some knowledge that we're sharing, NNABIlife.com. So you can go check us out. There's a nice sort of chart that we put together so that it's very clear how, women, we hear like, oh, we're always going to have hormones. I mean, men do, by the way. But when we are younger, we have that kind of more predictable cycle, right? Peri is unpredictable. Keyword unpredictable, fluctuating up, down, sideways. That's why we feel the way we do. So it will be really helpful for us to get more facts. So please check us out there. And also we are doing a pilot. So what that means is that we're going to be launching in January with our natural product. But from next 2 months, we're actually, inviting our family and friends for sort of early access. So that if you're all for sort of taking the product, and we also, we can tell you more about it if you're interested to learn more, but you can, check us out and then talk to us. And then, if you meet the criteria, then we'll love to kind of have you try and then give us a feedback. So if you're interested, just ping us. And then, yeah, so that will be that. I know that Erin, you asked something, curious about herbal. Are we at tango? Yeah.
Yes, but Erin, if you're interested, we can connect separately, or you can reach out to contact@nabbilife.com. And we can, we can talk about it. And then even as EJ mentioned before, we can take some of these questions and flesh them out on our social in the next couple of days, just to make sure that we're answering all of your questions. And if there are any additional questions, please reach out, send us a note.
So thank you so much for your time. And then really, one thing that we really want, you to do is not only to check us out, but, please call up your girlfriends or a best friend, and then maybe just talk about Peri. Like, what do you know about Peri? Like, what symptoms you may be having? And start sharing. You'll be surprised how many women are actually experiencing some of these things that we all are experiencing. We just have not had a chance to really talk about it, but it'll come out. And so tell somebody that you love, who's a girlfriend, tell them, or sister, about Peri, because that it just starts with us talking. So thank you guys. And Drew Merrimore, thanks too. Thank you guys.
Thank you.
And we talk soon. Bye guys.